Hi guys, it's Tara Scott from Revitalize, and I am talking about PCOS. And today I want to talk about treatment. So basically, there are basically three main theories of options for treatment. The first one is if you actively want to get pregnant and you're not ovulating, you may need to have ovulation induction. Now, I'm not saying anything about natural approaches to fertility. I'm just saying in a traditional sense. The standard of care is to give you a medication like Clomid to make you ovulate. The traditional sense is if you need birth control, that's the second option, is to put you on an oral contraceptive, because what that does is it thins the lining of the uterus and prevents any overgrowth from the excessive estrogen that's unbalanced in PCOS. So when we see patients, they're usually wanting that third option is like they don't want birth control pills, because I've already talked about the risks of that, and they don't want to take fertility medication. So what options are those for those PCOS patients? Well, first of all, we do a full blood evaluation, and so that's usually traditional labs. So most of the time patients can see us and use whatever lab their insurance wants them to go to, and it may be covered if they have some lab coverage. We usually have these labs fasting, and we usually check their insulin, their A1C, and their glucose. We usually check their vital chemicals, and then we check their estrogen at a specific time of the hormone cycle. If they are not having regular cycles, we figure out what the best day is for them then. Not only will we check their estrogen, we'll check their progesterone, because that balance is very important in PCOS. We also will check their testosterone and DHEA, because high testosterone is an issue. So if we have someone who fits the criteria for PCOS, we'll first make sure they don't have something called metabolic syndrome, which we'll talk in the next video. But usually what we do is we can use a pharmaceutical option for low testosterone, like spironolactone. But some people don't like to use pharmaceuticals, so what are some other things you can do to prevent testosterone? Well, you can take something like zinc. That is an aromatase inhibitor, and the other thing is you can treat the cause, which is working on the insulin resistance. So if we find out that you have that, we'll usually discuss that. But I'm going to talk about that metabolic in the next syndrome. So generally we'll use something that will balance testosterone. Saw palmetto is something else that can prevent that. And then if estrogen is out of balance from progesterone, and I'm concerned that they could be at risk for uterine cancer, which is one of the things, sometimes we will prescribe natural progesterone. Other times we may use something called Vitex. So it's very important to work with a provider who knows the ins and outs of PCOS.